Hello everyone, welcome to MCoderTube. This is Nilesh Shende and today we are diving into important medical coding abbreviations. Yes, medical coding can feel confusions with so many short forms, right? But don't worry, in this video I will break them down in simple, easy and practical way. So you can understand, remember and use them confidently in real world medical coding. So if you are preparing CPC, CCS or COS, working as a coder or just want to improve your skills, you are in the right place. Now we will see each and every abbreviations whatever we are using in medical coding and medical billing, that all abbreviations we will see in this video. Okay, so one by one we will start, like different departments are there, so according to that department we will see abbreviations. Okay, so foundational coding abbreviations. What is the use of these abbreviations and what are the full forms? We'll see now. ICD-10 CM, International Classifications of Diseases. 10th revision, clinical modification. What is the use? This used for coding and reporting diagnosis. Okay, so this is actually ICD book. Okay, so from this book we are finding or we are searching diagnosis codes. Okay, then CPT, this is also book used for the reporting medical procedures and services. What is the full form? Current procedural terminology. Then HCPCS, then what is the use? Includes CPT codes and other services and supply codes. We will find from this book. Okay, HCPCS. What is the full form? Healthcare Common Procedure Coding System. Then CMS, what they will do? This is a federal agency and regulate the coding and billing. CMS. Okay. So what is the full form? Centers for Medicare and Medicaid Services. Then HIPAA, this is the act. Okay, so what it will do? It will protect the patient data and privacy. Okay, so what is the HIPAA full form? This is important. Most of the interviews and written exam, this full form will ask. Okay, HIPAA, health insurance, portability and accountability. Okay, so this is the HIPAA. Then HHS, Department of Health and Human Services, oversees public health programs in US. Okay, then OIG, this is also a one department, separate department. For this department limited vacancies will be there, but this is also good. Okay, so what is the OIG? It monitors healthcare fraud, waste and abuses. Okay, so what is the full form? OIG, Office of Inspector General. Then AMA, American Medical Association, the organization that maintains CPT codes. Okay, then WHO, everyone knows WHO. This is the organization, World Health Organization, and it develops the global ICD classifications. Then AHIMA, what is the full form? American Health Information Management Association. What they will do? Offers certifications and education. This is foundational coding abbreviations. Okay, now we will see RCM, revenue cycle and payer basics. So when I was in Mumbai, that time I uploaded one, so many people like that video. So if you want to watch that RCM cycle, how it will work, I will give link in description box. You can watch that video. Okay, now we will see regarding that RCM related abbreviations. RCM, revenue cycle management, the process that converts patient care into revenue. Okay, so that is RCM. EOB, though form will be there, EOB and ERA. Okay, so EOB, explanations of benefits, the document that explains how claim was proceed. This is EOB. Okay, same electronic version, ERA, electronic remittance advice. This is the digital versions of EOB. Okay, these two are forms. Okay, so In this form, patient information plus whatever services performed, those that services will be mentioned in this form. Okay, then COB. Okay, what is COB? Coordinations of benefits determines which insurance plan plays first when more than one exit. Then EFT, electronic funds transfer, direct deposit of payments from payers to providers. Then AR, account receivable, the balance of payments due to provider. Then POS, okay, so POS, place of service, indicates where the care was provided. Okay, so indicates where the care was provided. POS, place of service, there will be number of POS. Okay, so according to that POS number, we can find the where when the service was where the care was provided. Okay, so that is POS. DOS, date of service, the date when service was performed. NPR, this is important. NPR, National Provider Identifier. This will be unique number for providers. There will be the means each and every physician having NPI number. According to that NPI number, we can find who is that provider and where is his location. Okay, so that is NPI. TAT, turn around time, the time taken to complete tasks such as coding and payment posting. These all abbreviations regarding RCM cycle. Now we'll see denial and complaints. This is also important for certifications. Okay, for example CPC or CCS, sometimes it will ask. Okay, CARC, claim adjustment reason code, explain why claims was adjusted and denied. Okay, so this is the work of CARC. It will explain why claim was adjusted or denied. Then RARC, remittance advice remark code. So it will gives additional details on claim denials. Okay, then RCA, root cause analysis. It will identify why recurring issues happen. Okay, RCA, root cause analysis. It will identify why recurring issues occur or happen. LCD and NCD. Okay, so LCD, local coverage determination, and NCD, national coverage determination. LCD, regional policy for coverage under Medicare, and NCD, national coverage policy issued by the CMS. Okay, then NCCI, national correct coding initiatives. It will prevent incorrect CPT combinations. Okay, there will be one portal. In that portal we can add whatever CPTs we have. So in that portal, that NCCI edit will trigger with some CPTs, that will be column 1 and column 2. So we have to append the CPT if it's allowable, so we can append modifier to column 2 code. Sometimes both CPT we can't bill on same date or on same claim, so that NCCI will trigger like that, and we have to reverse column 2 code. Okay, so that is the use of NCCI. Then MAC, Medicare Administrative Contractor. Okay, so regional authority that process Medicare claims. Okay, MAC. ENM, Evaluation and Management, describe visits and consultations. So ENM, one separate chapter is there. In that chapter we can see like outpatient, inpatient, observation, consultant, okay, critical care patients. According to that situations, there will be separate CPT range. Okay, so according to that separate CPTs, so we can identify patient visit. Okay, so that is ENM. RBRVS, resource based relative value scales. Okay, so this is scale determines reimbursement rates under Medicare. Okay, OON, Okay, out of network. Describe provider not contracted with payer. Okay, that is also important. OON, out of network. So this is the denials and compliance related abbreviations. If anything I miss, so please comment and tell me which abbreviation I missed. Now we will see chart related and documentation related abbreviations. So this will be helpful for freshers. Okay. So CC, chief complaint. Okay. So the according means on the base of chief complaint we can identify the main reason for the patient visit. Correct. Then HPI, history of present illness, means what current issues patient having, that we can identify in by the help of HPI. Okay, history of present illness. Then ROS, review of systems, means in this ROS all systems they will review, means review the symptoms across the organ systems. Okay. Then P, physical examination, providers objective findings, means whatever providers find that he will mention in P, physical examination. Then H&P, history and physical. Okay, the complete initial assessment. Okay, so in this all assessment whatever he did, okay, so that he will explain in H&P. SOAP, subjective objective assessment plan. Okay, so this is the structure for progress notes. Okay, POS, plan of care, provider's treatment plan of the for the patient. LOS, level of service, indicates that complexity of the encounter. Then PN, progress note, provider's record of follow-up and daily care. Then audit related, means audit and quality monitoring. Regarding that we will see abbreviations. QA, what is full form of QA? Quality assurance and ensures what is the use? Ensures accuracy and consistency in work. That is the QA. QC, quality control. Then what it will do? It will monitor and maintain quality standards. Then CAP, corrective action plan, steps taken to fix identified issues. Then FWA, fraud, waste and abuse, focus area for the compliance monitoring. Then PHE, public health emergency, affects temporary coding policies. DRG, diagnosis related group, determines inpatient hospital reimbursement. Then MSDRG, Medicare severity diagnosis related group, a refined versions of DRG for Medicare billing. HCC, hierarchical condition category, used for risk adjustment coding. PDGM, patient driven groupings model, payment model for home health agencies. And QA, questions and answers, like Q/A, questions and answers, common format in audit, feedback and training. These all are regarding audit and quality monitoring. Okay, then we'll see financial flow and claim process. In this EDI, electronic data interchange, what is the use? Digital exchange for claim information. Okay, EDI. Then claim, CLM, claim, the form or file submitted for payment. Okay, so whatever we are working, that is called claim. Okay, PIP, payment in process, temporary payment status during claim review. TFL, timely filing limit, the payer's deadline for submitting a claim. RA, remittance advice, a document that summarizes the outcome of a claim. Then UB form. Okay, so UB04, uniform billing form 04. Okay, this is the form. used for the institutional or hospital claims. And then CMS 1500 claims form for outpatient and professional billing. Okay, so this is the outpatient and professional billing. And UB, uniform billing form, used for the institutional and hospital claim. Okay, that is the difference. The next, coding guidelines and book reference. Okay, regarding this, whatever abbreviations are there, we will see. NEC, not elsewhere classified. Okay, NEC, not elsewhere classified. What is the use? Used when no specific code fits the documentation. Okay, so that is the NEC. We can see in ICD book. Okay, NOS, not otherwise specified. So what we will do? It will used when documentation is too general. Okay, so that time we have to follow this guideline. DX, diagnosis. PX, procedure. DX and TX, diagnosis and treatment. Like this abbreviations we will get. Okay, Z, codes. Codes used for social and family circumstance and personal history. Okay, whatever Z codes CPTs will be there, that is the for family circumstance and personal history. Okay, then VYWX codes, means like these codes, external cause codes for injuries and accidents. Whatever code is there, that will start with VYWX, that will be external cause codes for injuries and accident. Then seventh character indicates, seventh character what it will indicate? Indicates episode of care and healing stage in ICD and CM. Okay, so these abbreviations we will get in ICD and CM book. Then career and credentialing terms, CPC. This is important terminologies. Okay, CPC, certified professional coder. Okay, so EAPC, credential for physician coding. Okay, so this is certifications that credentials given by the EAPC. COC, certified outpatient coder. This certification for outpatient coders. Okay, this is also EAPC credentials for facility outpatient coding. Then CIC, certified inpatient coder. This is important. This is also EAPC credentials for inpatient facility coding. Then CPMA, certified professional medical auditor. For auditor, some auditor they are doing this CPMA credentials for the auditor. Yes. CRC, certified risk adjustment coder, focused on SCC and chronic conditions. Okay, so SCC people they can do CRC. Then BCHHC, board certified home health coder, specializations for the home health agencies. CU, continuing education unit, required to maintain the credentials. HR, human resource, handles hiring and staffing process. KPI, key performance indicator, it will measures work efficiency or outcomes. RC, revenue cycle, refers to overall process from patient registrations to payment. Then workflow and operation, regarding abbreviations we'll see. AP, account payable, tracks outgoing financial obligations. Okay, SOP, standard operating procedure, documents how process are followed. Okay, SLP, service level performs, tracks delivery and quality targets. BPO, business process outsourcing, the model many Indian RCM firms follow. MIS, management information system, used for the reporting and data tracking. PO, purchase order, internal authorizations for service or TOOCs. Then ROI, Return on investment measures value gained from efforts or resources. QA and QC, that already we saw. TAT also saw. RCM also saw. Okay, so these all are the workflow and operations abbreviations. Clinical and public health context. BMI, body mass index, measurement of body fat based on the height and weight. Okay, so this is the BMI. BP, blood pressure, basic vital signs. Okay, DM, diabetic mellitus, common chronic condition. HTN, hypertension, high blood pressure. CAD, coronary artery disease, heart condition. COPD, chronic obstructive pulmonary diseases, lung disorder. CKD, chronic kidney diseases. HIV, human immunodeficiency virus, affects the immune system. Okay, HIV. AIDS, acquired immunodeficiency syndrome, advanced stage of HIM. URI, urinary respiratory infection, a common diagnosis in outpatient care. Okay, so it will be common. So these all are the abbreviations. I hope this will be very boring video. Okay, but it will be helpful for future, means in interviews or any other exams. Okay, so this will be helpful. So what is the last note for you guys? All abbreviation no need to remember. A quick reference guide for the beginners in medical coding and healthcare management. These are the abbreviations you will come across most often in medical coding, auditing and revenue cycle management process. Don't try to memorize them all at once. Instead, read them slowly, connect each one with where it appears in your daily work, and let them become familiar over time.